What a character. Send me one of those too. It looks really good. Well, October is National Breast Cancer Awareness Month, the perfect time to talk about the risk factors of the disease. Medical Imaging Manager Julie German of Cass Regional Medical Center joins us with more on the subject. Welcome to the show.
Thank you.
This is such an important thing that affects so many people out there, but there are some risk factors out there, so kind of go through what those are.
Okay. Of course, there are two main ones that we have no control over is being a woman and getting older. The older we get, the higher risk that we have for getting breast cancer, especially after the age of 55. Another one that we hear about most is family history. When we're talking about family history, the highest risk factor comes from a first-generation relative, and that means a mother, a sister, or a daughter. Another risk factor is the age that we start our menstrual cycle and the age that we enter menopause. The younger that we start, the younger that we are that we start our menstrual cycle, and the older we are that we enter menopause increases our risk because our body is exposed to estrogen and progesterone longer.
Interesting. I had never heard that before, because sometimes the type of breast cancer you can have can be hormonal. We'll talk about that in a second. But first, there's a lot of confusion about risk factors, because I have a dear friend who had no family history. All those things you're talking about did not affect her. I mean, she's very young and was diagnosed with breast cancer. So let's talk about some of the confusion out there.
Okay. So family history. It's one of the biggest factors that we talk about, yet only 8 out of 10 women who are diagnosed with breast cancer actually have a family history. So that's where risk factors become confusing to women, is we start hearing about all these risk factors and we identify with the risk factors that are associated with us, and women start thinking, when am I going to get breast cancer, not if. And most women who have more than one risk factor never get breast cancer. So risk factors are really just things that are out there for us to identify with and make choices for healthier living.
Let's talk about the different types of breast cancer, because first you get the diagnosis, and then they tell you what type that you're dealing with, and so that you can properly treat the cancer. So talk us through using this tool.
Okay. So here is a cross-sectional picture or model of a breast. And if you can see these lines coming down here from the nipple, that is a milk duct. The little pink lumps here in the breast, those are lobules. And so there's many different types of breast cancer. The three main ones that we're going to talk to are carcinoma in situ. And approximately 61,000 women will be diagnosed with this type of cancer this year. And in situ means it's in place. It stays in the place that it starts. It does not spread.
So luckily you could get a lumpectomy as opposed to getting a double mastectomy, and there's not as much.
Absolutely. Absolutely. Another type, the most common type, is invasive ductal carcinoma. And so it starts here in the milk duct, but it spreads outside of where it started.
So it can go to your lymph nodes and all those areas that could spread to your body faster.
And you can see here this red on the model is actually our chest wall. And these two brown spots here are lymph nodes. So if you have a cancer that started here in the milk duct and it spreads down into the fatty tissue and comes into the chest wall, that's where it gets into the lymph nodes and spreads.
And quickly, can you just tell us how often we should get screened and at what age we should start?
Sure. The American College of Radiology recommends being screened every year after the age of 40. Now, the American Cancer Society recommends starting at 40 up until the age of 55 and then going 1 to 2 years, and that's an individual's choice.
And you can talk to your doctor about that. Now you can find Cass Regional Medical Center at their Harrisonville location, or you can also call the number that is on your screen. So much important information. This is something that sadly affects most families. So we need to get all that good information out there so we can prevent it and detect it early. Thank you so much.
Thank you.